a master's in health education, no, from the Philippine Normal University. Dr. Bugayong is an officer, a commissioned officer of the Philippine Navy. So, as a commissioned officer, she started out as a commander, Commander Bugayong. And then, because she is so good, she got promoted to captain. And she did 21 years of active duty service. And she is also, because her service is at the heart of her being, she has treated a lot of our men in uniform in the Coast Guard. And even after her stint in the military, she proceeded to still do service through health education among aspiring seamen. So until today, her legacy continues, her legacy of service, and she is here to speak to us about her vast knowledge of medicine and how it applies to our natural to our natural defenses. She is, of all her accomplishments, I guess she will agree that her best accomplishments are being a grandmother to how many, Doc? Five grandchildren. And it goes without saying, she is a mother to 4 children. Okay. Five children?
4 grandchildren.
Five children and 4 grandchildren. Sorry about that. So, ladies and gentlemen, let's all welcome in our midst Dr. Rose F. Bugayong.
Ako na yung mag-ano. Dito na rin ako. Parang
Gwapo nang nag-assist sa akin. Dalawang gwapo. Oo. Pina-practice ko lang kasi baka ma-discover ako kung lola ni Jimmy Pabricas. Good morning.
Good morning.
Kaya yatang wala sumagot. Morning.
Good morning.
Bakit good morning tayo? Kasi mahirap yung afternoon, palubog ng araw. Kagaya namin, palubog natin ngayon. Sura na, yung mga kernel. Pero bata pa tayo, natatawas na. Now, before we start, please stand and we'll say a short prayer. O Diyos na makapangyarihan, bukal ng buhay at sandigan ng aming kinabukasan. Sa kababaang loob, kami po ay taos-pusong pumupuri sa iyo. Salamat, Panginoon, sa pagkakataong ito na binigay mo sa amin upang kami ay magtipon-tipon at talakayan ng live enzyme ang totoong kalusugan at totoong kasaganahan. Mapagmahal na Ama, patnubayan mo kami sa aming mga gawain. Turo mo po sa aming mga isipan at damdamin ang tunay na pagmamahal sa bawat isa. Maawaming Diyos, maraming salamat sa lahat ng biyaya na binigay mo sa amin. Turuan mo kaming maglingkod ng buong puso sa aming kababayan. Iligtas mo po kami sa lahat ng kamalian, kapahamakan, sakit, kahirapan, at mga di karapat-dapat na gawain. Kasihan mo kami ng iyong banal na Espiritu Santo upang magkaroon ng panibagong pananaw sa tunay na paglilingkod sa iyo, sa bayan at sa kapwa. Patnubayan mo ang aming kumpanya, Pillars 5, ang mga namumuno, naglilingkod at mga kasama sa negosyo. Maawayang tagaligtas, tulungan mo ang aming kapamilya, mga kaibigan at lahat na namamayapa na nagtatamasa ng buhay na walang hanggan. Mapagmahal na Ama, Idinadalangin namin ang mga namumuno ng aming bayan mula sa Pangulo at ibang mamabatas. Patnubayan mo sila ng iyong lakas at talino sa kanilang pamumuno upang ang bansang ito ay umabong tungo sa kapayapaan, katarungan at kasaganaan. Ito ang aming dalangin sa pamamagitan ni Jesucristo, aming Panginoon at Tagaligtas. Siya naman, yung Father, Son, and Holy Spirit. Thank you. Please sit down. Pasensya ka na, Andrew, hindi mo naintindihan ang aming dasal. Dapat mag-aral na ng Tagalog, ano, si Andy.
Okay.
Okay, alam niya.
Go right ahead.
Okay. This is a live enzyme for cancer prevention and therapy. I placed the picture of my daughter, my eldest daughter, who is a victim of cancer. She passed away at the age of 33. She's a Navy doctor assigned in Zambales during the eruption of Mount Pinatubo. She's a major of the Armed Forces of the Philippines Medical Corps. But on the 7th chemotherapy, she delivered a child who is a replica of my daughter, the reincarnation. And she looks like her, same face, same everything. The way she eats and the way she spends money. If she's with me now, I'm busy here giving lecture and she will be busy in Mega Mall spending money. And sometimes she tells me this is the happiest moment of my life when she has spent so much. As is now, she left her child at the age of 7 months and now she is 18, a scholar at the La Salle University, taking economics. Now, my objective in coming here is to acquire knowledge and create awareness and life insight for cancer prevention and therapy. And you have lots of things to learn here, but I have to condense it. Yeah. And of course, I have to explain it because some may not understand. Now, if you say cancer, it is the very name alone scares most people. As if you are signing your death certificate. You know, in a few years' time, you will pass away. In medicine, cancer is the most common term for malignant tumors. And cancer cells grow in masses several layers deep. So it can affect the skin and go to the bone tissue and bone marrow. The normal cells, they have limited lifespan, and this is controlled by the telomere gene, which signals the end of the cell line. Now, cancer cells contain the telomerase, which is an enzyme. This is the one controlling the age of our cells. And this alters the telomere gene, allows the cell to continue to divide. Now, the cancer tissue grows without limits, and it competes with the normal tissue for nutrients. And eventually, these cancer cells will kill the normal cells by natural deprivation. So, in case of, instead of the food going to the normal cells, this will be eaten up by the cancer cells. Now, cancer begins in your cells, which are the building blocks of your body. And these new cells, they grow even when you do not need them. And all cells do not die when they should. And these extra cells, they are accumulated, and then they can form a mass called tumor. And virtually all organs and tissues are susceptible to cancer. You know that every person, all of us, we have cancer cells. but it depends upon our lifestyle. Now, cancer cells do not show up in the standard test until they have multiplied to a few billions. When you are being examined, if if the X-ray says it is negative, it does not mean that you don't have cancer. It means that it's not visible through those tests. The cancer cells occur between 6 to 10 times in a person's lifetime. And organs in our body, we have 100 trillion cells. Imagine that. One can undergo cancer. And the cells divide and multiply as the body needs them. And if these cells, the number of cells increases by 3 billion, it is called disease. Cells is parang bukol lang. But if it is more than 6 billion, it is called cancer. Now the growth, they can be benign or malignant. What do you mean by benign? It is non-cancerous. But if it is malignant, it is cancerous. The neoplasms are very smart and can hide anywhere and go for a good speed undetected. Like for example, my daughter, she was having an ordinary camp, and she didn't know she has already cancer. The problem is we doctors, we are treating patients. We are the instruments of God to heal patients. The problem is we neglect going to our doctors. And the mass in her lungs was already 12 by 13 cm. Here, there's no need of oxygen to live, at least 99.9%. And you can kill most of it with special treatments, but only one cancer cell to survive will spread. And the cancer is built to survive. Nearly all pathogens, including cancer cells, are protected by a protein-based coating called fibrin. And this is the same stuff in your scar tissue. It's very thick. And it's difficult for immune system to identify and destroy them. This sticky coating is thicker. It's 15 times thicker than the ordinary cell. And the cells, they grow together to form tumors armored with fibrin. And these are designed to prevent the body's own defenses. What are they? The natural killer cells, the white blood cells or oxygen, from getting inside the cell or tumor and destroy it. Now, same defense that keeps chemotherapy out of the cells in all but industrial strength doses that are just likely to kill the patient as the cancer. Sometimes our patients, they die not because of the cancer, but because of chemotherapy and all those ingredients that they inject to the patients. Because some of them, they destroy the normal cells. Not only the malignant cells, but also the normal cells. And this keeps out whatever natural agents patients may be using to combat the disease. Now, what is the prime cause of cancer? The prime cause is unknown up to now. So we don't know exactly the treatment for cancer. If we don't know the cause, we don't know the treatment. But sometimes we can suggest some medications or some alternative treatment to cure cancer. Now, unhealthy or diseased cell is lacking of sufficient oxygen, but they still produce energy. Now, this energy burning process is called sugar fermentation. And this releases mainly lactic acid and carbon monoxide instead of carbon dioxide. And this cell is functioning anaerobically. What does it mean? It can function even without oxygen. Now, cancer, viral diseases, and others flourish in this environment, especially if we have little oxygen or no oxygen, and we have low pH, that is an acidic environment. Now, scientists claim that there are many causes of cancer, but there is only one prime cause, the lack of oxygen at the cellular level. And these cancers are caused by a series of mutations. What do you mean by mutations? These are changes in the genetic sequence, and each mutation alters the behavior of the cell. Now, the course of cancer. As I said, the human body consists of 100 trillion cells or more, depending on the body weight and the condition of the person. And water is 75 to 80%. And this cell is composed of the nucleus, cytoplasm, and the cell membrane. Now, our body is constantly bombarded by very harmful substances. These are known as free radicals or oxygen radicals. What are they? They are highly unstable molecules that are naturally formed inside our bodies by the process of oxidation. Huwag ko nang masyadong explain kasi baka ma-manang mind yun. But if I explain this so much in the medical terms, siguro konting review na magiging doktor na ho kayo. Instead of mukhang doktor. Destroy your cells, tissues, and organs. These are normal byproducts of everyday functions like digestion and physical activity and others. What are the outside sources? Ito yung mga outside sources na free radicals. They are poor diet, or oxidized, or partially rancid food. Kaya yung mga nasisira, huwag na natin kainin yun. No? Environmental pollution, these are synthetic chemicals added to our water and food, polluted air, dust, exhaust, and others. And then drugs, or surgery, radiation from the sun and various electrical appliances, lifestyle changes like alcoholism, smoking, stress and activity, aging. Hindi na tayo nag-i-age, sila lang ang tumatanda. This is risk factors. Cancer, heart disease, arthritis, immune system diseases, and other conditions. Now, these free radicals, they are lifeless. And they lack one electron, and they steal an electron of another molecule. And this will spread, and the process is repeated, producing a domino effect. Kaya pag mayroong isa lang na cancer cell, mag-i-spread yun. In order to protect us, the enzymes need help from substances known as antioxidants. Other antioxidants are acetyl L-carnitine. No need to memorize that. Now, the spread of cancer from one part of the body is called metastasis. And they are named from their site of origin. For example, cancer of the lungs, which spreads to the bone, is not bone cancer. It is lung cancer that metastasizes to the bone. Cancer cells that spread are similar to those of the original cells. Yan. Now, carcinoma in situ, yan ang medical term for cancer that has not spread. May mga cancer din, hindi nag-spread. So that is called carcinoma in situ. Here, let me show you some cancer cases. Pasensya na kayo, wala ito sa during my time, Japanese time, wala pa yan. No, hindi yan.
Ay, forward po.
Wait, no, direct one. I-focus ko na. Okay. Now, this is a brain cancer. You see this? This is the cancer. If you came early, you have seen the, you have heard the video about the doctor who had brain cancer. He had brain cancer, and this was removed, and then he did alternative medicine. He's cured. Ito yung normal brain natin. This is the cancer cell. This is the colon cancer. Ito yung colon. Ito yung cancer. Natakpan na yung colon. Now, I've been advising people not to drink soft drinks because it can cause accumulate undigested food, and this can be accumulated in the colon, and this might become cancer. At saka ito, madaling mag-isip. The vegetables, the more nutritious it is. Carrots, cauliflower, lettuce, mushrooms, onions, and ginger. Beverages, cocoa. You drink cocoa, you pure cocoa. Fresh fruit juices, mineral water, natural water, and milk. Nuts and seeds, almond, chestnut, pumpkin seeds, sesame seeds, sunflower seeds, squash seeds. Spices, cinnamon, yeah. What you are doing here, you put cinnamon in your sandwich, curry, ginger, mustard, pepper, salt, miso, and soy sauce. These are the acid-forming foods. They make you sick. Fats and oils, avocado, naku, sarap pa naman avocado, canola oil, corn oil, cotton seed, and grape seeds. They recommend the olive oil, pero napakamahal naman ng olive oil, no? Better, I saw in, this, in television, one time, there is cooking utensils, no need of putting oil, nothing. You just cook it. It's, pa-plug ko na 6,000, 3 pounds. Yeah, you save the oil, they save everything. Grains, amaranth, barley, buckwheat, corn, oats, quinoa, rice, rye, and wheat. Hindi natin kinakain ito. Mga Americans lang yan. Merong American dollar lang ito. Animal protein, beef, pork, chicken, oil, clam, oil duck, eggs, fish, lobster, and pork. Pasta, macaroni, spaghetti. Buti hindi na mention dito yung bihon, kasi kakain tayong bihon. Birthday ko ngayon, ha? Okay. Hindi kayo nag-happy birthday sa akin, ha? Thank you. Nuts, kasoy, Brazil nuts, peanuts, pecans, sweeteners, candy cake, black beans. There. This is according the one you saw, the video. According to Dr. David Servan Scriver, MD, PhD, clinical professor of psychiatry and a brain cancer victim, University of Pittsburgh, in his book, The Role of the Body's Natural Defenses in Preventing and Treating Cancer, he said that cancer equals loss of equilibrium, which means there is no equilibrium here. Here are the promoters of cancer: tobacco and alcohol. Number 1, sugar and white flour, omega-6 fatty acids. I just mentioned here, it's not in the video, Because you might ask me, omega-6, ano, piniprepare ko na, ano ba yung omega-6, doktora? Alam ko na ang sagot. Yesterday, yung mga kwan na yung mga doctors walang maitanong sa akin. Ay, salamat, sabi ko, walang, hindi nila naintindihan ang lecture ko o naintindihan nila na wala silang ma-question. Kasi karamihan sa aming mga doktor, mahirap mag-lecture po sa mga doktor. Kasi mga piloso po kami. Tsaka huwag kayong masyadong mag-explain because the more you explain, the more they question you. Ganun ang mga kwan. Tinitip mo na kayo. Pag may nag-question sa inyo na hindi nyo masagot, tawagan nyo lang po si Dr. Bugayong 0999-800-6391. Ayun. Ako nang bahalang sasagot. Total naman mga kapwa ko, ganyan. Pilosopo. Chemical pollution, sedentary life, yung mga kami na mga senior citizen, karamihan sa amin nakaupo, nakanganga, naghihintay ng dollar galing sa US, galing sa mga seaman. Wala na pong, asan ba si American dollar? Wala na pong pera sa Amerika. Nandito sa atin ang pera. No? So, they keep on sitting, inactive, hindi sila naglalakad. Ako sobrang sa lakad. Yesterday, I was surprised, I slept for 9 hours. Yung galing ako sa Muntinlupa. It took me 3 hours to travel from Parañaque to Muntinlupa. Yung short distance ng 3 oras ako. Pati paghihintay ko ng mga sasakay sa jeepney. Kasi nakasakay ako sa jeepney. Wala akong kotse. Meron akong Cadillac. Okay. 3 hours. So when I went home, 9 hours ako natulog. Chemical pollution, sedentary life, powerlessness. Anong powerlessness? Yung wala kang mga madaingan, wala kang kaibigan, wala kang kamag-anak. Pero yung pag problema sa pera, wag na kayong dumain. Mag-member na lang kayo sa Life Enzyme. Nandito ang pera sa Life Enzyme. Pillars 5. Here. Lack of sunshine. Yung iba hindi na pumupunta under the sun. Up to 9 o'clock, you expose yourself for 20 minutes. 20 minutes and you get 20,000 international units of vitamin D. Yan. Ito ang mga promotor ng cancer. Ito naman, inhibitor of cancer. Yung hindi kayo magka-cancer, you eat anti-cancer phytochemicals. And what are these? These are green vegetables. And then omega-3 fatty acids like flax seeds, walnuts, sardines, salmon, soybeans, tofu, shrimps, Brussels sprouts, and cauliflower. Detox phytochemicals like broccoli, cauliflower, and red cabbage. This does not only inhibit cancer but also good as anti-aging vegetables. Physical activity. Kahit na 30 minutes lang na activity nyo, naglalakad kayo, brisk walking, social support, yan. Kailangan marami kayong kaibigan. Okay. And then, I just came from Iloilo. I met some friends. Kasi dito sa atin, and also you talk to people. Kasi we were brought up sa Filipino kultura, do not talk to strangers. Pero dito sa business, I learned this in business kasi hindi naman ako businesswoman as a doctor. I learned in business, you talk to strangers. Otherwise, wala kang kliyente. Wala kang one. You cannot promote your product. So we have to change that attitude. Kultura natin Pilipino, do not talk to strangers. Pero pag stranger at nine-interviews ka, baka mabudol-budol ka, kausapin mo, huwag mong magsanglas ka. para hindi makita yung eyes mo. At baka mamaya ay nabudol-budol ka. I normally wear sunglass when I am outside. No? When I am outside. And do not see straight to the eye yung tao. Dati kasi mahihiyaan ako when I talk to somebody, nakayuko ako. Kasi may nung nagsalita kasi na tandang-tanda ako yung pag si Doktora Bugayong pag tininindan ka, natutunaw ka. Hindi naman ako nagbukuan, diba? Yung Chinese eyes daw, nakakatunaw. Here, social stress management. Stress, no? Ay, may problema sa buhay natin, kasama yan sa buhay. Hindi lang ikaw ang may problema, lahat tayo. What's sa walang problema? There's no such thing as problem because there is always a solution to it. Then, yung mga sikon, di ba? Yung stress, sabi ko sa inyo, si Judith. No? Kilala nyo si Judith, no? Judith ng Meralco, Judith ng PLDT, Judith ng tubig, dahil na naman sa matriculation fee. Lahat na daanan natin yan. Wala hindi problema yan. Sunshine, you have to be exposed to sunshine 20 minutes. At saka, pag nasa under the sunshine kayo, huwag kayong maglagay ng UV cream because it will not penetrate. And then after 9 o'clock, that's the time you put your UV cream. Now, mind you, you put also UV cream kahit hindi mainit ang araw because there is still, kahit hindi mainit, mayroon pang UV rays. Here, 20 minutes will give you 20,000 international units vitamin D. Adults over 50, our requirement is 800 to 2,000 international units. Here, let me mention this one which you saw in the video, air out dry clean clothing. Pag kayo yung nagpapadry clean, tanggalin nyo yung cover muna tapos paaraw nyo, no? Because that will remove the cancer-giving foods in the dry clean. Karamihan ng mga nagtatrabaho sa dry clean, they will be prone to cancer. No? Avoid pesticides, insecticides, avoid chemical cleaning products, avoid parabens and phthalates in cosmetics and perfumes, avoid PBA-based, hindi PBA ito na basketball, no? Bisphenol A, a carbon-based synthetic compound of it. Avoid inorganic additives, avoid skin contact with aluminum. Okay, that ends my presentation. I hope I have you learned something. And next time, please encourage people to attend our lectures. It's not very easy to make a presentation because you spend sleepless nights to make your presentation. You know that I read 4 o'clock when I wake up in the morning. I read and read and read and check in the internet what is nice to be presented. Next time probably we'll touch on whatever subject you want. I can touch on arthritis. Kasi karamihan din actually ako rin nababalaktot na rin. Mayroon lang ako mabili na sing-sing na matakpan itong daliri ko. It's okay. Thank you very much. Madalang ma-spread sa other parts of the body. This is the cervix of the patient. This is the cervical cancer. You know, we teach women to examine themselves. They just place their finger inside the cervix, and then they will just feel it. If it feels as if they are touching their own nose, then that is normal. But if they feel that they are touching something which is very rough, that might be, there is something wrong there. And they have to be examined, biopsy for cervical cancer. This is the breast cancer. We don't know where the nipple is anymore. Breast cancer. I have seen a case of cancer yung sa breast, parang bukol-bukol siya. Nalala na. I don't know if this is the nipple or where is it, but this is the cancer lesion.
Parang insimada.
Oh, no, let me mention also, my first time to see, when I was an intern at the Baguio General Hospital, I saw a case, syphilis, let me touch on something. Yung advanced syphilis pala, yung sa lalaki, nagiging hindi mo na makikita, they have the penis, no more. Parang, siyempre nasa Baguio ako that time. Parang nakita ko na may cauliflower na nakatouch doon sa atas sa lalaki. Hindi talagang totoo. That is, when you have a case like that, pati yung utak ng pasyente, yung unstable mo. That is the, talagang malala na. Naputput na. So pag lalaki yan, ayaw nang mabuhay. Pag naputput na yung kanila. Tama ba yun, Sisa? Yan ang pancreatic cancer. Ito yung cancer. Yan. Ito yung pancreas natin. Yan ang pancreatic cancer. Ito pag natamaan ka, within 2 months.
That's how fatal.
Like the case of my sister-in-law, within 2 months, nadali talaga siya. Kaya ingat-ingat lang doon sa mga may diabetes. May diabetes. Tapos this one is the prostate cancer. Tawag ko dyan, prostatal cancer, prostation cancer.
Is it really true, Doctor?
Yeah, prostate.
A very...
Ayan, ito yun. Nagpapara dyan sa prostate nila. This is the cases of lung cancer. Ito yung mga lobes, 2 lobes. Pero nandito yung cancer. Yung nadali dun sa anak ko, yung nadali dun sa anak ko is small cell carcinoma. So pag ang diagnosis is small cell carcinoma, hindi binubuksan yun. Kasi once nabuksan mo, it will spread like mabilis ang pan. Just leave it there if it is small cell carcinoma. Other cancer siguro you can remove it, pero yung small cell carcinoma, pabayaan mo na lang. My daughter lived for 3 years after diagnosis. Ito yung sa makukuha mo sa smoking. I don't know why people keep on smoking. Hindi lang mga lalaki, mga babae rin. But sometimes I tell them that if you don't like to have wrinkled skin, you better stop smoking. Because the smoking can cause wrinkling. I still think that if, for example, I bring all smokers to the lung center of the Philippines and the heart center of the Philippines and see for themselves, patients gasping for breath because of cancer of the lungs and COPD, which means chronic obstructive pulmonary disease. Recently, we lost the commandant of Philippine Marines because of COPD. Then probably people will stop smoking. You don't get anything from smoking except cancer of the lungs. Ito na, natakpan na yung cancer. Right and left lungs. Kaya pag smoker ka, bumili ka na ng lote mo sa Irritating, Viola, tsaka piliin mo na yung casket, kung yung
Mura na remake na lang.
ha? Yung anong klaseng kung anong isura ng casket. Prepare something already for your burial. Kagaya ng husband ko, I didn't know that he was preparing money for his burial. So, ibang klase yung tao. You know, my husband was a chain smoker when he was a port ship. And it took me many times to keep on nagging him to stop smoking. And he does not like to stop smoking. And then one day, one of his officers died because of cancer of the lungs. Immediately the next day, he stopped smoking. Stroke him. But it took one officer of the Philippine Navy to die before he stopped smoking. That was long time ago. Here, skin cancer. Ang ano?
Morning sunlight naman. Morning sunlight. Kailangan protein.
Ito, nakikita nyo yan. Do you see this one? Yan. Yan yung cancer. Pag mayroon kayong, if you have a mole, black mole, which changes in color, it becomes violet or reddish, and then it becomes corrugated, at saka yung nagbi-bleed, better have a mole removed. I have a big mole here. I had it removed long time ago. Here, do you see this there? That's the cancer. Ayan, sa skin. Ayan. Yan ang mga itsura ng cancer. Here, nandito sa leeg. Tsaka, tingnan nyo, natakpan na yung ano niya. Nasira na ang mukha niya. Skin cancer. Skin cancer, this is what we call basal cell carcinoma. Here, nandito. Yan ang mga cancer cells. Dito yung, ayan, mag-ingat kayo sa eyeliner. Mga eyeliner, no? I remember when my second daughter got married, they thought I was crying. I didn't know I was allergic to, gusto nila akong pagandahin. Luha ako ng luha. I was allergic to the eyeliner.
Allergic reaction.
Yeah. Ito, sa kwan, below the ear. This one, mag-ingat kayo sa, what do you use that? Eyeshadow. Here. Ayan, cancer. May there are some ingredients they put in cosmetics, perfumes, no? Lipstick. Natakot ako, I don't use any lipstick anymore. Kumuha ka na lang siguro na pulang papel, ilagay mo na lang dito. O, atsuete. Here, how do you prevent cancer? Cancer cells thrive inside the body if the pH is acidic, 5.5. Yan, acidic.
When I go around, I go to the malls, I see distilled water. I don't drink distilled water. This is acidic. Distilled water is used only for injections and batteries. And cancer cells cannot thrive in an oxygenated alkaline environment. So better drink alkaline water, any water, but not distilled water. And you can see this in one of the biggest malls in our country. Cancer cells cannot thrive in an oxygenated environment. Exercising daily and deep breathing help to get more oxygen down to the cellular level. So when you wake up, you go to your garden and do deep breathing, you will get oxygen there. And please do not put plants inside your bedroom. Why? Because you will be breathing carbon dioxide instead of oxygen. Now, when the person's immune system is strong, the cancer cells will be destroyed and prevented from multiplying and forming tumors. So take supplements that build up the immune system that are very high in antioxidants such as live enzyme. Wala ba kayong kamay dyan? Sodium ascorbate, do not take ascorbic acid because that is acid. Take sodium ascorbate because that is alkaline. Then grapeseed, fresh fruits and vegetables, and vitamin E to enable the body's own killer cells to destroy the cancer cells. Here, a diet made of 80% fresh fruits and vegetables. I think you have seen the video. He changed the Dr. Snyder, changed his diet, 80% fruits and vegetables, and 20% of protein. He does not eat meat because cancer cells, they feed on meat, especially the red meat. So do not give meat to cancer patients. Do not give also sugar because that's the food of the cancer cells. Then fresh vegetables juices provide live enzymes that are easily absorbed and reach down to the cellular levels within 15 minutes to nourish and enhance the growth of the healthy cells. Now, to obtain the lifestyles for building healthy cells, take live enzyme, try and drink fresh vegetable juice, most vegetables including bean sprouts, and eat some raw vegetables 2 or 3 times a day. But be very careful with your vegetables. You please wash with diluted vinegar to remove the amoeba. I experienced this because I was the only intern in Bugayong who had no amoeba, and all the interns had amoeba because I did eat vegetables in Baguio, fresh vegetables. You know what, the fertilizers they used before, not like the fertilizer now. Now, enzymes are destroyed at temperatures of 104 degrees Fahrenheit. This is important to all those your business partners. Please emphasize how to prepare your enzyme. You might be taking your enzyme and put it in hot coffee. It's useless because these are live enzymes and they will be killed by heat. Enzyme therapy. A weakened immune system due to an unmet enzyme deficiency allows for the accumulation of pathogens. What are these pathogens? These are disease-causing agents and carcinogens. These are cancer-causing substances. and the body's inability to suppress or contain the growth of cancerous cells. Now, enzymes are needed. The bulk of these enzymes are protease or proteolytic, which are found also in our live enzymes, which means that they speed up the breakdown of proteins. You know that because of one of the causes of cancer is the fibrin, and fibrin is a protein. So what we do is we take protease or proteolytic and then destroy the fibrin, which is a protein, and this will destroy the cancer cells. Now, in sufficient quantities, they digest the protective, this is what I was saying, protective fibrin membrane and expose the cancer cells to the immune system by increasing the white blood cells of the blood. This is called leukocytosis. You can see this in your examination when you have your blood examined. There is an increase in the WBC, that is leukocytosis, which will result to the death of the cancer cells. So it can help also. These are the natural, we have this inherent in us, the natural killer T cells of the immune system, which are called lymphocytes. And these are target the cancer cells. What do these lymphocytes do? They deliver toxins, they produce holes on the cancer, and combat cancer and kill the cancer cells. That is the work of the lymphocytes. Now, the pancreas produces most of the body's enzyme supplies. So if your pancreas is defective, you will have no protection. Now, metabolic enzymes assist this often overworked organ and help stave off cancer. But if you get the metabolic enzymes, which are inherent in your body, and the work of those enzymes are to heal patients, then you don't have already enzymes that will fight disease. You will get sick, prone to disease. Metabolic enzymes are taken on an empty stomach to facilitate their entry into the blood. Here, due to their protein digesting capabilities and health enhancing properties, therapeutic doses of metabolic pancreatic enzymes have been successfully used for decades to help treat cancer. This is according to Dr. Anthony J. Chikok in Enzymes and Enzyme Therapy. We have that book here. Enzyme therapy improves the body's defense powers and retards the growth of the cancer cells. What do these enzymes do? Here, these are the work of enzymes. Here, they degrade the fibrin. You know that the cause of the cancer cells is fibrin. And then remove the glue with which the cancer cells attach themselves, because these cancer cells attach themselves. They will attach to be together. Enzymes can break up immune complexes and chew up the fibrin. Here, people with an increased risk of cancer can reduce that risk by taking live enzyme. So live enzyme is for prevention and also for therapy. But we do not give, in cancer, we don't give only one sachet. We will give more than 3, and there is no overdosage in live enzyme. Here, it's gaining importance in hospitals, especially in Germany, Italy, France, and the United States. Here, if radiation and/or chemotherapy are necessary, lower doses than usual can be just as effective in concurrent enzyme administration. So if they reduce the medications, it is also effective because there is also the live enzyme taken by the patient. Here. In addition to tablets, enzyme mixtures can be injected directly into the tumor. Can be directly injected. We can see the tumor because of by X-ray. You know, my daughter was diagnosed. They wanted to open up her, but they put a deep needle through X-ray, and then they got aspirated something from the mass, and it was diagnosed biopsy, and it was diagnosed as a small cell carcinoma. And then you can put also the enzyme direct to the cancer cells. The administration of an enzyme mixture is openly accompanied by improvement of the morale of the cancer patient. You know, if you have cancer, some patients, it's really very, very painful. You see, when there was a suspect of cancer in my daughter, it was like a big blow. You see, you cannot even explain to her, she is your daughter, you cannot explain to her that she has cancer. So what I did, I just put the X-rays on the cabinet, in our cabinet, in such a way that both of them, husband and wife, can see the X-ray plates. But it's really very, very difficult for a parent to tell your daughter that she has cancer. Here again, their appetite, put on weight, and I have seen her, she keeps on eating. Malakas ang ibang klaseng cancer siya. She wanted to eat. So, of course, she is a terminal case, so you have to give everything, all the foods that she wants to eat. Put on weight, cease to be depressed, and feel considerably more alive, both physically and mentally. Now, cancer patients and other illnesses, we advise patients not to just sit down and then be inactive and think of their diseases. What we do is to isnabin mo yung sakit mo, no, para magiging hindi masyadong malala. And it might disappear also. Enzymes substantially reduce the occurrence of metastasis and recurrence of cancer, make malignant tissues more sensitive to radiation, reduce pain and other side effects. When used in conjunction with surgery, they reduce post-operative pain and hemorrhage. Yeah, terminal patients that are very, very painful. If you want to see them, just visit patients at the Philippine General Hospital, and they are like Mona Lisa. You know Mona Lisa? They just lie there, and they just lie there. Just go and visit them. That's very, very pathetic. You know, between suffering, I myself, between suffering and death, I would rather choose death than severe suffering. We will go there anyway. Effective against cancer of the reproductive organs, breast skin, Hodgkin's disease, and leukemia. Here, diet, what is the diet? Diet rich in fresh fruits. As I said, 80% fresh fruits and vegetables. Whole grains and low in fat may well be the most effective alternative approach of all because it may help prevent certain cancer. Not only cancer, but other degenerative diseases. Some alternative diets aim to rid the body of toxins accumulate from the food we eat in the Western world. Here, strictly vegetarian, raw sugar-free, and low in salt, vegetables, fruit juices, and high doses of soy products like tofu. Yeah. This is the Bristol diet from UK, developed at the Cancer Health Center in Bristol, based on alternative diet in the UK, United Kingdom. I remember, anong pinagkabalahan mo ngayon, doktora? Nag-UK. Tapos sabi nung nagtanong sa akin, psychologist, hindi ka napapagod, doktora? Hindi naman. And then we were already seriously talking about UK. What do you mean by UK? The United Kingdom, doktora. Hindi, okay, sabi ko. Here, emphasis is on whole foods, fresh fruits and vegetables, raw cereals, and organic fish, poultry, and eggs. Avoid dairy products. I don't know how, because I've been drinking milk since I was a child up to now. Use organically grown products. This is the Gerson diet, the dietary approach to treat cancer and other diseases. Focuses on the role of dietary factors in restoring health. You drink 13 glasses of juice from fresh organic fruits and vegetables. 13 glasses every day. Vegetarian meals from organically grown fruits and supplement like logos. Here, cancer cells thrive in acid environment. A meat-based diet is acidic. So do not eat so much meat. Once in a while lang siguro, no? But what is once in a while? Is it every day? Once in a while? No meat. If you have cancer, no meat. Because meat, especially the red meat, is the food of the cancer cells. The cancer cells will grow, spread. Here. And meat also contains livestock antibiotics, growth hormones, and parasites which are all harmful, especially to people with cancer. I myself, I don't eat lechon. Kahit anong sarap ng lechon, I don't eat lechon. Because when I was in high school, I was brainwashed of tapeworm, worms. So I don't eat tapeworm. I don't eat tapeworm. I don't eat lechon. Kahit na sabihin mo yung sa balat, no, I don't eat. These are the top 5 cancer causing foods. This is an Enzyme article. Joshua McCarroll revealed the top 5 cancer-causing foods. Number 1. I placed there where this came from because they might say I'm the one who made this hot dog. Number 1. The Cancer Prevention Coalition recommends that children should not eat more than 12 hot dogs per month. See? Because of the risk of cancer. Now, if you eat hot dog, look for those without sodium nitrite listed among the ingredients. So when you are going to, go to grocery, make it a habit to read all the labels on the package that you are buying. Meron nyo ba? Basta bili ng bili. Sige, area. Number 2 is processed meats and bacon. Because this contain the same sodium nitrite found in hot dog. Now you can find some without nitrates, but you will have to look for them in natural grocers. Bacon is also high in saturated fat, which contributes to the risk of cancer like breast cancer. Limiting your consumption here of processed meats and saturated fats also benefits the heart. Better you make your own processed meat. Kaya na lang gagawa. Number 3 is donut. That's why it is called donut. Donut eat. There is a new donut now. This one filled with too much sugar, too much glaze. Ayan. No, I don't eat that. Donuts contain hydrogenated oils, white flour, sugar, and acrylamide. Essentially, they are one of the worst cancer foods you can possibly eat. Reader's Digest calls donuts disastrous as a breakfast food, and many experts agree it is probably one of the worst ways to start the day. French fries. Fries are made with hydrogenated oil and fried at high temperatures. And these, not only do they clog your arteries with saturated fat and trans fat, they also contain acrylamide. They should be called cancer fries, not French fries. This is what you give to your children. McDo, Jollibee, chips, crackers, and cookies. Sometimes I don't like to lecture on this because sabihin nila, doktora, wala naman na tayong makain. Nilagay mo na lahat dyan. No? Okay. They contain white flour and sugar as well as trans fats. And sometimes there is monosodium glutamate in yeast extract, artificial food coloring, or by fiddling with serving sizes. I recently I read about this yung red gulaman. Masama pala yun. We have to use the white gulaman because of the food coloring. So, wala na tayong makain. These are the 10 top carcinogenic foods. You see, carcinogenic foods, these are any charred food from burnt popcorn to burnt toast is highly carcinogenic. There is one favorite among people here nowadays. They serve what is the plural of rice? Anybody who can say what is the plural? Rices ba? Ha? Sino? Maka-guess. Plural of rice. Ayan, unlimited rice. Yan ang plural ng rice. Ito, plus the barbecue with charred chicken. Nako, cancerous yun. Meat in general, in terms of the fats associated with cancer, especially overcooked meat. Overcooked meat. Sugar is carcinogenic. Na-mention dun sa video kanina. Whether white or brown. Instead, I used to take that muscovado rice, but I don't take muscovado rice. Ano ba yan? SM na yata ko ha. Muscovado, sugar. I am taking honey. I don't use sugar. Ayan. Instead of sugar, substitute with raw honey. So sometimes I use when I go to the province, I used to buy the molasses. The one that they give to horses. You know why horses are stronger than people is because they eat molasses. Yan ang but since I don't drink coffee, I don't use anymore sugar. I just use raw honey. I add it to my life enzyme every morning.
Not in the coffee.
Laging na ito ha. I have been taking, ano nang nagastos ko dito sa life enzyme? I've been taking life enzyme for the last 3 years. Araw-araw. Dapat may kwan pala ako na, 20% discount ako dito. Hindi ba? Say you see the sale? 3 years na, continuous. Kaya ako, gusto ko kasi nababawasan ang edad ko. Sabi nila, hindi ko sinasabi na nababawasan ng edad ko. Sabi nila. No. But yesterday, I gave lecture to doctors yesterday at Montelupa. That was the first time na one of the doctors was able to tell my age. Binigyan ko siya ng premium. Sabi niya, bibigyan ko rin, wala, puro, para mga burang na ito, wala lang pa. Alam niyo ng edad ko. Okay. Because if there is someone who is new here, and you guess my age, I will give you a prize. House and lot.
50 plus.
Stomach cancer is associated with high salt intake. High salt. Spicy foods and smoke, ha? Huwag masyadong kumain ng very salty. You know, when you are cooking your food, I can smell if it is salty or not. If it is salty, I really perspire. No need of testing it. Sodas are carcinogenic for a variety of reasons, being high sugar content and harmful additives. Sodas leads, leads the minerals, especially calcium. That is temporarily gained through the other healthier foods. Trans fats found in fries and snack chips. Artificial sweeteners like aspartame. Excessive alcohol is also toxic. It's not only toxic, but it will reduce your age by 20 years. So if you will be alive for, your lifespan is 100 years, you will live only up to 80 years. Yan lang, pag sinabi na ni San Pedro, pinirmahan na niya yung pan mo, yan, talagang you have to go. Foods cooked at high temperature usually contain acrylamide and farm-raised fish and fish product. Here, this is what is the meaning of acrylamide. If you see acrylamide, this is produced industrially for use in products such as plastic, grouts, water treatment products, and cosmetics. Kasali ang cosmetics. Kasali mga cosmetics, kasali yung mga perfume natin. Tama na lang yung amoy ng katawan. Basta wala din pan. It's you they are talking about. It's okay. No problem. Found in cigarette smoke, cause cancer in animals exposed to acrylamide at very high doses, causes nerve damage in people exposed to very high levels at work. So those who are working in factories, they have this trace if they have acrylamide. These are the most notorious carcinogens found in our diet or environment. Acrylamides, this is, basahin nyo na lang, huwag nyo na lang i-memorize. Wala naman tayong examination. Yan. No need to memorize these things. From heated fats and oils. Yung mga oil nyo, nagtitipid kayo, lagi yung ginagamit. Over-roasted coffee, pesticides, herbicides, fertilizers, car pollution, deodorants, fragrance and aluminum, polychlorinated oils. And we have this nicam substance. This nicam is a substance found in lipstick. See, it's dangerous also to beautify ourselves. No, tama na lang yung unless gusto mo pang mamingwit. Ako hindi na ako namimingwit. Single ako pero hindi na. One time I went to the 40 days ba? 40 days. Sabi ko kay na Charing, midwife ko ito, puro dalaga yan. Kasama ko yan sa opisina. Nagpunta kami sa 40 days. Ay, mag-ayos-ayos kayo. Darating yung mga balo na mga sundalo. Sabi ko sa kanila. Nung dumating na kami doon sa 40 days, Sabi naman ng mga lalaki, naghahanap daw sila ng mga asawa nila, no? Mga balo. Sabi, biglang nagsigawan itong mga single na women, mga balo. Ako, sabi nila, nagalaga na kami ng matatanda, magalaga na naman kami matatanda, sabi nila. Sabay-sabay silang nagsalita. Okay. Here, fuels, polycarbonate, plastic bottles. Importante sa plastic bottles ng bata, mga toys, food containers. Here, may food containers. Meron tayo yung mga, yung nilalagyan ng pagkain. In our house, I changed already all the bottles. Yung lalagyan natin ng tubig, pinalitan ko na ng all glass. Lahat ng glass. Plastic pen. Here. These are the alkaline-forming foods. Fruits, these are apples, bananas, blueberries, cantaloupe, cherries, grapes, raisins. Grapes, yung grape seed is gone. Yung grapes, okay. Pero yung grape seed, you chew, some people, they chew the grape seeds. That is acidic. Grape nut, olives, peaches, pears, persimmons, pineapple, strawberries, tangerine, watermelon. Sweeteners, raw honey, and molasses. These are good. Vegetables, asparagus, broccoli, broccoli. Yeah. Me, I eat sa mga elderly, I don't say mga natatanda. I don't like to mention that. For the elderly, I eat broccoli, cauliflower, cabbage. Those are first cousins. Those are anti-aging vegetables. Plus you eat raw saba and sweet potato. Those are anti-aging. Okay. Then, better the red cabbage because red cabbage is more nutritious than the green cabbage. You will notice here that the darker the color of
Meron po bang may mga tanong? Questions from what we heard from Dr. Bugayong? Oh, sige.
magtanong, kumain na tayo.
Aba, may merienda si Doc. Okay, kung wala po tayong tanong, then I guess everything is clear. And thank you so much for attending our forum this afternoon. Oh, si Colonel. Colonel, may tanong po. Doc, may tanong si Colonel.
Doctora, I wasn't able to pick up one subject matter. Parang mention mo dyan sa lecture mo na you discourage drinking yung distilled water. Yeah, why?
According to findings, Rahul, it's just relaying it to you, but it's coming from the internet. Distilled water is acidic. It's acid. It's acidic. If we say it's acidic, it gives you are prone to illness. But if you take something which is alkaline, then you will be protected against illness. Yeah, we usually use distilled water in injections and batteries. That's where we use the distilled water. But please try to check also in reading. Then you can, if you see something about distilled water, because I know it's in the internet. Thank you. Yeah, the one I don't like to mention. Yeah, I don't like to mention where I see distilled water. But one time, I attended a convention, one day convention I forgot to bring my water, and the water that they are giving us is distilled water. So the whole day I didn't drink water. Ang feeling ko is para na akong lumulutang. Ganun ang pag hindi ka nakainom. Because supposed to be every hour we have to drink water. That's the food for ourselves. No? So better if you want, you bring your own water and put your life enzyme inside the bottled water. Thank you.
Well, thank you for your question, Colonel. But if I may also add, Doc, yung sa distilled water po kasi, the reason why it is highly acidic, meaning when it enters your body, it is acid forming, is because it's what they correctly call pure water. When you say pure water, ang distilled water po is hydrogen, diba? 1 atom of hydrogen, 2 atoms of hydrogen, 1 atom of oxygen. Yun lang po ang chemical component ng distilled water. Whereas naturally occurring water is not just those two elements. Meron pong minerals. It's the minerals that make the water alkaline. And because our bodies need alkaline, we need to have an alkaline balance in the blood. Kailangan po may minerals yung tubig natin. Kaya we advise you, instead of taking distilled, you buy mineral water. Ano po yung mga minerals? Yung mga calcium, magnesium, potassium, sodium, iron. And then, aside from these macro minerals, meron pa po tayong tinatawag na trace minerals. Yung mga iron, copper, zinc, selenium, very, very small amounts. But you will not see these minerals in your water because they are totally dissolved. Okay? So, totally dissolved. So, that is the composition of very healthy water, the presence of minerals. And when you distill it, pag ang tubig po kasi dinistill, pinapaano po yun binivaporize. And since yung mga minerals, although they are totally dissolved, mabigat, maiiwan po yun pag dinistil yung tubig. Pagpasok no sa next chamber, pag nag-condense na, tawag nila yung vapor, magko-condense. Yung condensed water, yun na po yung distilled water. Naiwan na yung mga mabibigat doon sa kabilang chamber, yung pumasok sa kabila, demineralize na. So, kaya po, hindi buhay. Kasi po, ang buhay ay nasa minerals. That's why they call distilled water dead water. Yan po ay tubig sa baterya, sa radiator, etc. Ngayon po, kaya siya ginagamit sa mga medical, as a liquid, as a suspension. Kasi nga po, may ihahalo na mga gamot-gamot. So, the minerals might interfere with whatever substance they will put in that medical solvent. Kaya po, distilled yung ginagamit. Pero kung pang-inom, kailangan po mineral water. Yan po yung alkaline water. Okay? So, any other question? Yes, Lucy.
Earlier, the Torah said that you're not supposed to put plants in our bedroom. Bedroom.
Yes.
I thought the plants are good for us because they give out oxygen, they
Yes.
absorb the carbon monoxide.
Yes, yes.
As doctor.
You can answer it.
Paggabi kasi
Nabaliktad lang siguro ni Doc yun. Because humans give out, ang ating po kasi, ang ating poisonous substance is carbon dioxide. Okay? Which is gustong-gusto naman ng halaman. So yun i-absorb nila. Yun naman pong nilalabas ng halaman, oxygen. Nag-exchange tayo.
The Torah could you answer
So we hope not only did you enjoy Doctor's talk, you are enjoying your pansit, courtesy of Doc Bugayong. Thank you so much, Doc. And may we remind everybody, ang ating pong promo tuloy-tuloy hanggang tomorrow. Tomorrow is October 31st. Anong promo natin?
2 boxes and the third box.
Yes, correct. Buy 2 boxes of Life Enzymes yung pong 30 sachets, and you can get the third box at 50% off. Okay, ang laki po nun, 725 pesos. So, pagka nag-avail kayo nun, you can take more Life Enzyme. Or you can retail more. Get more retail income. Ano pa? And another announcement, ito pong ating series of forums, A Life Well Lived series. After this week, we are back again here next week. This time again with Dr. Samuel Dizon. Please put it in your calendars. This time, the forum of Dr. Dizon is from start to finish, an open forum. So, lahat ng mga, forums niya before that concern topics like chronic degenerative diseases, cancer, diabetes, kidney, heart disease, and then he touched on detoxification and also yung mga dangers ng prescribed medicine. If you have questions about that and even beyond that, he will be willing to answer that next week. He will be here. We will be back at 5:30. Time schedule 5:30 p.m. Okay, with Dr. Sam Dizon. We'll be having flyers available. Hopefully by tomorrow, available na yung flyers natin. And then after Dr. Dizon, we will be having Dr. Marlene Agabon again. Okay? One after the other yan. So these are very exciting times for a Life Well Lived series because we will be bringing you topics that you have never heard before. Dito nyo lang po maririnig. And many of them will shock you. Okay? So, huwag mag-absent. Present lagi and bring your notes. Okay?
Tatanong ko po sana kayo, Doktor.
Apo.
Yung bang dinadialysis, pwedeng mag-take niya kaya?
Yung dinadialysis? Well, when Dr. Dizon was here, he discussed diabetes. Of course, enzymes are very much prescribed for diabetic patients. Kaya lang po, yung nature kasi nung hindi pala diabetes, kidney failure ito, Yung po kasing mga end-stage kidney disease patients, they are very critical at saka sensitive. You cannot take one case and generalize it for everybody. Bawat pasyente po is its own unique case. So kailangan po talaga ng medical guidance. So even if they're taking enzymes and all, kailangan with the aid of a medical practitioner, yung tumitingin sa kanila. Kasi po, like certain herbs, sinasabi ni Dr. Dizon, certain herbs can worsen the patient if they take too much of a certain something. So, kailangan po merong monitored ng kanilang physician na nakakaintindi, hindi yung basta physician. Kung alternative doctor yon, then kailangan na monitor. Yun naman po of all diseases, yung end-stage kidney disease, yun po talaga ang mahirap talaga. Kailangan case-to-case talaga yon at highly monitored.
Five criteria.
Okay? Alright. And hopefully, you stay around after our forum and have a fellowship and talk business with one another. Thank you very much.